Okay, so my name is Bianca Schulz and I work at Munich University at the teaching hospital. I'm an internist, small animal internist. And so my...
That's good, that's good. That's all we need to know. So Bianca, antibiotics, AMR, presidents are talking about it, everybody's talking about it, but clearly it's one of the most serious subjects that we face as a society. But what does it mean for you? What does this subject, what does it really mean scientifically?
Yeah, as you say, it's something of global importance, but it's also something that concerns us in daily practice and private practice and referral practice, because we see more and more resistant cases. So it's not just a theoretical threat to us, but something that we see on a daily basis in humans and in animals as well.
Okay, and I mean, obviously, as a result of that, you feel sufficiently motivated to get involved in initiatives such as GRAM. You know, you've been working all day long, you've put a lot of effort in. You know, 5 years from now, if you look back and you look at that effort and you look at trying to get this consensus together, what do you think would make it all worthwhile?
5 years from now, I mean, it would be great if we don't just sit here and come up with guidelines that end up in a book that only some or that's only for some people who are interested, but for like the normal vet in private practice, guidelines that you can really take out of your pocket or look at on your smartphone when you need them, and really apply them to daily life and to decision making in your patients.
And you know, I think that was really the survey that we did really reflected that exactly, that, you know, veterinarians were saying to us that, you know, that's where we need some help, that's why we want expert advice. If we look, you know, if we put that in place, what does that mean for the future of antibiotherapy?
Well, hopefully it means a more tailored or specific approach to antibiotic therapy. I think there are many vets out there who have their two antibiotics on the shelf that they use if they, most of the time, suspect bacterial infection. And what we want them to do is think about how can I diagnose the infection, depending on what pathogen it is and what organ system it is, which antibiotic do I choose for this disease, for this patient, what dosage, how long, that all these things are considered when antibiotic treatment is initiated.
We're all up against Dr. Google these days, and we've seen that there is recent surveys, there's so much misconception about antibiotics, antibiotic resistance. How do you think we can really, you know, what you just said, how do you think we can put the veterinarian back at the centre of a rational prescription process and bring the public pet owners along with that?
Well, I think it's something that probably has to, the education of the veterinarian has to start in vet school, and not only out in practice, but really when people learn how to use antibiotics and for what indications to use antibiotics, and then go out in practice and use what they've learned. So I think it's an educational process that should start on a very early stage.
I don't want to put words into your mouth, but GRAM, if you were to sum up GRAM, and if you could just start the sentence with GRAM, what is GRAM? What should GRAM be?
Well, GRAM should be a fantastic opportunity to include knowledge of different experts in a special field, put it all in a nice book, easy to use for most practitioners and easy to access for everybody, to make daily life antibiotic use and hopefully the problem of antibacterial resistance better in the future.